We should actually get a doctor in here because...
Yeah, I could probably have a lot of unanswered questions.
Oh my God, bring me! Pick me! Pick me. I will come. I will be the doctor of I would love to help. Hey guys, it's me again, Dr. Jake. Welcome back to my channel. Today I'm going to react to the show where Trixie Mattel and Katya Katya. It's the show where Trixie and Katya talk about whatever they want because it's their show and not yours. In case you don't know who they are, Trixie Mattel is a drag queen who appeared on RuPaul's Drag Race Season 7 and then won RuPaul's Drag Race All-Stars 3. That was a crazy season. And then Katya is another drag queen, and she's sort of known for being this Russian hooker. It's her thing. She was on Season 7 of RuPaul's Drag Race with Trixie, and then she went on to do really well in All-Stars 2. She was one of the finalists. Sorry about those spoilers, but if you haven't seen the show by now, you're probably not going to watch, so I'm not feeling too bad about it. Sorry. So in this episode of they talk about doctors, and as a gay doctor myself, I have to watch and talk about what they're talking about, right? I gotta do it. Let's get on.
Ready?
Yeah.
Oh.
Hi.
Wait. Sorry. Oh, you're very warm.
Does she have a fever? Probably not. If she had a fever, she wouldn't be there because they're pretty big on testing for COVID in media situations now.
When you go to the doctor, I think it's the beginning of Jurassic Park where they're brushing off bones. And then a helicopter comes by and they're like, cover it!
No, every time I walk into the waiting room, the receptionist is like, life finds a way.
I sometimes feel like that when like a 98-year-old comes into the hospital. Life finds a way. Somehow this person is still alive. Whoa.
Listen, doctors, a rich people's game? Kind of.
Totally. In this economy, in this country.
They're always like, go, don't wait. But when you go,
No.
it's never anything.
Nope.
What do they tell me? You have very white eyes and your lashes are long.
I get that. I actually feel the same way when I go to the doctor, even though I am a doctor. Primary care is boring. Usually you're telling people you don't have anything. You're good. Come back in a year. And it sort of feels like a scam, but really it's those 1% of people that you do catch something in that really matter. So, you know, it's not medical advice, but go to your doctor.
We should actually get a doctor in here because...
Yeah, I could probably have a lot of unanswered questions.
Oh my God, bring me! Pick me! Pick me. I will come. I will be the doctor of I would love to help. I'll be there. Come on, pick me. Me. I promise I will not sing on your show. Unless you ask. If you ask me, I will sing.
Oh, you ever try to make a dermatology appointment?
Bitch!
Can't do it. Can't,
months.
Oh, you can't do it. Yeah, you can't do it.
You're like, well, can I just get a cream? Can I get a cream? Yeah, that's great.
Dermatology is one of the most lucrative fields of medicine because they don't do that much. I mean, don't get me wrong, they diagnose skin cancer, they do a lot that's very important, but in terms of the time commitment, they don't do that much. It's really nice. It's like a 9-to-5 job, sometimes like a 10-to-5 job if you do it right. But it's really hard to get into after medical school, so it's a pretty limited crowd that's able to do it. If you like skin, I'd say do it, but you do have to see a lot of gross skin things. Granted, as an internal medicine doctor, I also see a lot of gross skin things, but I'm not responsible for really dealing with them. If somebody has a rash, I'm like, cool, that's a rash. That can be dealt with in a clinic, not in my hospital.
I have been to the doctor a lot because of drag-related things. Where like, I get home from Drag Race and my nails are like all disgusting. And the doctor's like, oh, why don't you try respecting your body?
Actually, I can see how that would happen because drag queens put so much stuff on their hands. Some of them put makeup, you're painting your nails, you're treating your nails with random things that probably aren't actually meant to be put on the human body. Fungal infections, I imagine, are pretty common in the drag community. And of course, they're pretty serious because you want your nails to look good. So if you have a fungal nail infection, it makes it really hard to paint them again.
Do you think it's important for gay people to have gay doctors? Because you know gays are like, who's your gay doctor?
Yeah.
I actually think it can be important for some gay people to have gay doctors. It can be hard to be honest with your doctor because many people do things that aren't great for their health. Now, let me just say, I am sex positive. I think people should have as much sex as they want as long as it's safe. But I understand that some people have unsafe sex. And as a doctor, it's not your job to judge that. Although, let's be honest, I love to judge people. It's like a second career at this point. But it is my job to help you realize, number one, what is safe and help you make informed decisions, even if my helping you make an informed decision doesn't change your actual decisions that you make. And number two, it's important that I at least pretend not to be judgmental, because you need to come to me when something actually goes wrong from the decisions that you made, right? If you get an STI and you're not able to tell me I'm having sex, I may not be able to actually help you. So if you can't trust your doctor with your sex life, if you don't trust your doctor enough to tell them about your sex life, you probably do need to find another doctor.
Because we do things.
Yeah, we do.
Like, hey, I have a chemical burn from the spiral perm.
Yep.
And
A gaping...
a person stuck in my ass.
People do get things stuck in their butts. It's rough. Okay, not medical advice. This is just personal advice at this point. If you are going to put something in your butt, make sure it has a flared base. That means the base goes out, okay? Out. You want it to have a flared base because that way, when you put the thing into your butt, the flared part sort of protects it from getting stuck in there so it won't go all the way in. I've seen way too many things stuck in butts. That's why I have to say this.
I wasn't going to the doctor. I'm not going to the university clinic.
No.
To wait 3 hours for another student to tell me to take a Claritin because my leg fell off. You know what I mean?
The jig was up when I realized that every doctor I had was like a third-year resident.
If you are getting the third-year resident, then you are very lucky. If you're going to an academic hospital, like the university hospital in your area, the doctor that you're generally going to be seeing is going to be the intern, the first-year resident who doesn't have any experience. That third-year resident, they're like ready to go. They're out of there. The next year, they're going to be a practicing physician. That's fantastic. But if you're getting that first-year doctor, you're in trouble. I was a terrible doctor when I was a first-year resident. It's really hard to be a first-year resident and actually do good medicine. Really hard.
Yeah, I feel like I could deal with something like that really well.
Well, you're in your mid to late 40s, which gives you a little more perspective.
Yeah. You know, I've been seasoned by the sands of time.
Gay people are like, I'm really sexually active.
The next time I have an old patient who's like 92, I'm going to say, you've been seasoned by the sands of time. And they'll say, what? Help! Because that's typically what my patients say because they often have dementia. And then I'll probably repeat it, and they'll say, what? Help!
It's like, guess what, Linda?
Yeah, I can smell the cancer from here.
Yeah, because sex gives you cancer.
It doesn't?
Sex can give you cancer. HPV, which is a sexually transmitted disease, human papillomavirus, it is a big cause of anal and throat cancer. For those of you with vaginas and cervixes, it can cause cervical cancer. I, to my patients, recommend getting the HPV vaccine. And when I still worked as a pediatrician, I recommended that kids get this vaccine as early as age 11, because then they're protected for life from HPV.
I don't implicitly trust doctors because I know how lazy people are.
But do you think they went through 8 years of medical schooling to be lazy?
Hold up, Trixie. Technically, there are some doctors who do 8 years of medical schooling. Typically, those are the MD PhDs. However, physicians go through 4 years of medical school and then 3 to 7 years of residency training. And if you have questions about what it takes to become a doctor, you can take a look at my video about what it takes to become a doctor.
No, they go for the money.
No way, bitch.
Yeah.
Doctors do not make this money. Doctors do not make this money. Give me to a doctor! Doctors do not make that much money.
They make a lot of money.
Not more than us.
Well.
I know how much they make, and doctors do not make more than they do. How much does a doctor make? Depends on the region that they work in and the specialty they work in. So like the plastic surgeons working in like LA, they can pull in $1 million easy. The orthopedic surgeons replacing hips, they can pull in $1 million actually pretty easily if they really want to. Internal medicine doctors, family medicine doctors, pediatricians, it's less than you might think, especially considering that many of them have like $300,000, $350,000 in student loans just from medical school. It's a little tough.
Are there like Christian doctors where they're like, I'd recommend, I would recommend 2 acetaminophen and a prayer.
Yeah, Christian scientists. No. Yeah, the healing power of prayer.
Pick a lane.
Well, a lot of people die because prayer doesn't It's weird because prayer is not a really adequate substitute for antibiotics.
Prayer is not an adequate substitute for antibiotics. That is true, Katya. I do think that physicians should be sensitive to people's religions and encourage them to do those things in their religion that make them feel better. If prayer makes you feel better, go pray. If going to church makes you feel better, go to church. It's not my place to say. But please, if you're coming to me for medical advice, you don't have to do everything that I recommend. But please don't tell me that I'm wrong. Yeah.
I was watching this program, and this woman had cancer, and she believed that her urine would cure her cancer. And she would pee in a cup, she would pee in a shot glass. You're not ready. I need you to stay here. You can't run out of frame.
Did she put it in her eye?
Yes.
I'm gonna run out of frame. I'm gonna run out of frame for this one. I can already tell that this is gonna be disgusting.
She held it up to her eye, and she would hold it up to this guy and then open her eye and let the urine go in her eye.
No, nobody should pour urine in their eye. Unacceptable. Unacceptable.
She would also bathe in the urine. And she was like, cancer? I've got pee, thank you.
Bathing your urine is probably fine, but don't put it in your eye. Once the urine leaves your bladder, it is no longer sterile, and you can get an eye infection from that. It's the ultimate pink eye. It's yellow eye. Ugh.
That's wretched. Also,
That's what I'm saying, a doctor would intervene.
yeah, they'd tell her to booty bump it.
I also don't think that you should booty bump your own urine either. Please don't do that.
You're in a gangbang, you're getting raw dogged, like what's the, like very specific details of
Yeah.
just like over and over and over.
Did the doctor use the words, are you getting raw dog?
He was like,
He had a clipboard, and he had a monocle, and raw dogging.
raw dogging.
Okay, I would recommend, this is not medical advice, it's advice for all the doctors out there. Don't use the word raw dog to describe sex to your patients. Just don't. I think bareback is already sort of stretching it because we can just say sex without a condom. That's easy.
Then it came to the part where they got to get some cultures.
So they went art museum,
Art museum.
concerts, yes.
The library. Have you ever seen those giant long Q-tips?
Yeah.
You know what I'm talking about? So they had to take some swabs from my rectum.
Yeah.
Yeah.
And let me tell you,
Actually, it's pretty important when you're testing someone for gonorrhea or chlamydia to take swabs from the rectum and throat because you can get gonorrhea and chlamydia there, and it may not show up in your blood tests or urine tests.
There were 3 wet ones and 3 dry ones.
before the Q-tip, you pushed out 3 wet ones. And then a dry one. It's just like cat food.
Dry cat pellets.
A body cone. A body cone.
There is no reason that you should ever need to do 6 swabs on somebody to get your sample, though. Never.
You know, usually doctors like this is how this is gonna feel. This is, you know, like when you're gonna feel a pinch. Blah, blah, blah. You just
No warning.
no information. He took the thing, and it was like it turned into like Sleepaway Camp 3. He just shoved it up my ass.
No!
Like I
No! No, we don't do that. Don't consent in all things. Consent in sex. Consent in all things. Consent for sex. Consent for putting something into somebody's private parts because it's a medical exam. Consent, 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 which means they have to understand what's going to happen.
dry. It was. I thought that my ass
It was like
mangled.
he was crochet hooking your intestine.
I felt like he was exploring a vendetta that was like 20 years old. Like
He was looking for his keys.
Yeah, it was. I was so horrified, and I figured, okay, there must be blood everywhere. I must have just like.
You were ready for like full red
Yeah,
wedding.
yeah. I
Just-
was, oh, this is like this is useless now. That's pretty much it. Oh, then he put a finger in, and it felt great.
So actually, as part of a rectal exam, you do need to put a finger in someone's butt, and what you're checking for is the prostate. You want to make sure that it's regular. It's okay if the prostate is a little bigger than you might expect, but what you're looking for is you want to make sure that there are no irregularities in the prostate that could indicate prostate cancer is there. So I hope you guys enjoyed this reaction. I hope it was educational. I had a lot of fun watching this. I will probably react to more content like this in the future. So do me a favor, if you like this video, hit the subscribe button, hit that like button, leave a comment. Tell me what you think of Trixie and Katya. Tell me what you think of HPV. That's fun, right? Maybe a little dark. I don't know. Tell me what you think of HPV. Sure, why not? And I hope you guys had a great day, and see you in the next one, right?